In Thailand, the Thai people have benefited from the Universal Health Coverage Scheme for over a decade, since 2002. The UHC scheme has caused many changes in the Thai public health system so that all Thais can have access to standard health services according to the changing economic, social, and political context. In this regard, health personnel and agencies concerned, directly and indirectly, have to adapt themselves to efficiently implement the established guidelines. True success is not in the learning, but in its application to the benefit of mankind. Priority setting for health promotion by community. Suan Luang Municipality, Krathum Ban District, Samut Sakhon Province. For Thailand, all concepts and practices for solving the problems of health system require people's participation, which is an important factor. People's participation in thinking, doing, planning, and decision-making in accordance with their ways of life, as well as support for external organizations, is the way out.
แล้วก็เลือกมืออาชีพ
Dr. Prateep Thanakitcharan, Deputy Secretary General, National Health Security Office, NHSO, said, health problems are partly caused by poor environmental conditions. Upon the emergence of local administrative organizations, the Universal Coverage Scheme, UCS, has established a community health system so that local agencies can participate in its operations. Suan Luang Sub-District, Krathum Ban District, Samut Sakhon Province. Samut Sakhon is a province adjacent to Bangkok, the capital of Thailand, which was previously a major agricultural area of the country, but currently parts of the province have become industrial zones as economic prosperity and quality of life seem to go against each other. Environmental problems arise. Ms. Amara Chiu-Tiem, President and founder of the Suan Luang Community Council, said, during the major flooding in Bangkok a few years ago, there were problems of wastewater drainage and those related to the opening of many industrial factories in this province. Some of the industries did not follow the rules on wastewater management, resulting in water pollution that affected local residents' health. So they had to assemble to find ways to solve such problems. The assembly of the people on that day has evolved into the Suan Luang Community Council, whose aim is to seek ways to solve health problems resulting from environmental pollution. In this effort, the Council has set up systems for monitoring, follow-up, and coordination with relevant government agencies in jointly solving the problems. Their actions began with the gathering of health data on at-risk people in their locality, health screenings by doctors, and public education on healthcare. And joint efforts were made to develop healthy environments for health by setting up a health promotion project for at-risk population with funding from the local Health Security Fund. According to Thailand's National Health Security Act of 2002, local and community participation in local health fund management, aimed at creating local residents' health security, is a major intent of the law. Dr. Prateep said, health problems are partly caused by poor environmental conditions. Upon the emergence of local administrative organizations, the Universal Coverage Scheme has established a community health system so that local agencies can participate in its operations. The National Health Security Office has allocated a health service budget for local health funds to carry out health projects or activities related to health promotion, disease prevention, rehabilitation, and primary care, which are essential for health and livelihood of local residents. The funding contribution from the NHSO is made with a capitation arrangement. In this sub-district, Suan Luang municipality is responsible for the management of the local health fund. At present, the capitation budget contribution of 45 baht per capita is made by the National Health Security Office for health promotion and disease prevention to the local health security fund, while the municipality allocates a certain amount, making the operating budget of the fund amount to 5 or 6 million baht per annum.
ใช้คำว่าบูรณาการนะครับซึ่งการบูรณาการครั้งนี้ถือว่า
Mr. Niran Pomnoy, Mayor of Suan Luang Sub-District Municipality, said, "We give importance to people's health and integrate all of our relevant plans with that of the National Health Security Office. We provide both financial and technical support for the fund, and it is one of our top priority strategic plans." From the concept to practice, the popular or civil sector has assigned teams to monitor and examine water quality in their designated zones and report the results to the Community Council. All team members have been trained in basic water quality testing. If it is found that the water quality does not meet the standards, they will jointly identify the cause and then coordinate with other agencies concerned in inspecting and solving the problem. And they all joined the municipal inspection team in inspecting the industrial factories in the locality. The monitoring and inspection function is one of their important activities.
แต่ถ้าหากว่าจะปล่อยให้ประชาชนรับงบมาโดยตรงเลยเราก็
Ms. Amara Tiutiam said, "It is the need of the popular sector to assemble and work together. The work was initiated by the people. Initially, the public sector did not get involved, but after our work began to materialize, state officials began to take part. Using this working approach, Suan Luang Sub-District might be the first to develop and show the people's role. We have voiced the problems that occurred, synthesized the lessons learned, and proposed plans for solving the problems, so relevant state agencies know what we would like to get done and how the people can participate in solving local problems for the better health of the community." In connection with the local health security fund, primarily there are plans to encourage people's groups or organizations or local agencies to carry out health promotion activities in various dimensions. Here is the learning center of the Thai Traditional Medicine Group and the Community Herbal Medicine Group of Suan Luang Sub-District. The center has collected and planted varieties of medicinal herbs for use in their community, especially in emergency situations. It is the learning place for community members and other people coming to study agricultural practices based on the sufficiency economy philosophy. The two groups have received funding from the local health security fund for growing medicinal plants or herbs and give them away to other interested people and for training for knowledge dissemination purposes. Mr. Prasad Su Choi, chairperson of the Suan Luang Community Herbal Medicine Group, said, "Previously, I was a village health volunteer who carried out a number of activities and has gained a lot of knowledge, especially of herbal medicine from my ancestors. The use of Thai traditional medicine and medicinal herbs available in the community for health promotion has created an alternative for medical care and health promotion In addition to that, in the modern healthcare system, I would like to disseminate the knowledge to other people so that they will know and use it for healthy living. So I am undertaking these activities, opening the center, and training other people so that they will learn and practice the skills at home.
มีคนพิการนะคะที่นอนติดเตียงเราได้ออกมาจาก
In addition to the aforementioned community organizations, the youth are a driving force of community-based activities. Today, an activity is organized for youth to learn how to make pillows for bedridden patients and herbal compresses, using Thai wisdom for the benefit of the community. Besides, there are other several activities for children and youth, as well as the community, to realize that the problems have affected human health, physically and mentally. The activities, financially supported by the local health fund, can help resolve the problems for children and youth.
เทศบาลตำบลสวนหลวงก็เลยเล็งเห็นว่ากลุ่มเนี้ยทำประโยชน์ให้กับตำบลอยู่แล้วเป็นกลุ่มจิตอาสาอยู่แล้วก็เลย
Ms. Sai Phon Iem Jamrat, advisor of the Children and Youth Council, said, youth in this community also have problems like those in other places. Video game addiction and teenage pregnancy, resulting from social changes. Their participation in creative activities helps them improve self-awareness skills, spending their worth for public benefits, getting away from the problems, and creating a strong community. The prioritization of activities is necessary in dealing with such problems. Health promotion and disease prevention activities are high priorities assigned to 3 groups: the Suan Luang Community Council, the Suan Luang Child and Youth Council, and the Suan Luang Community Herbal Medicine Group. People's participation at all levels, community, local administration, and policy making in this sub-district has reflected the fact that the process for problem identification and prioritization based on the community's lifestyle and context is the tangible aspect of the health problem-solving approach in Thailand.
เราก็มีความพยายามที่จะสร้างการมีส่วนร่วมประชาชน
Dr. Somsak Chunharat, Secretary General of the National Health Foundation and former Deputy Minister of Public Health, said, appropriate selection or priority setting is what every country wishes to pursue, because making a decision on what to undertake is a complicated process. Decision makers normally have various perspectives, and good decision making cannot rely on the opinions of just a few people. The ultimate result of priority setting is the joint decision on a certain thing from various differences, based on adequate information and
เพื่อ
facts.
ทำ priority setting